Thank you so much, kind introduction from the chairman. Good afternoon, actually, and I'm Ed Mundula from Macau. And my presentation topic is the Healthy Macau Blueprint. And I'm the Vice General Secretary of the Asian Heart Society and a specialist in cardiologist. So just now, Professor Zhang Weili already mentioned the Healthy China 2013, and because Macau is the part of the China, so we also have a healthy policy for the population, and we have already followed the plan from the mainland China government. And now we are facing three main challenges. One is that the increased risk of the chronic diseases. And the second is the raising healthcare demand. And the healthcare service raised up to 60% in last 10 years. So it makes the situation is that become a major source of the death in Macau. And for the chronic diseases, genetic factors contribute to 30%, so that we have to control the other 70% from the individual. So how to make it happen? We have three policies. One is to advance intervention point from healthcare to health. The second is that to reallocate the resources from hospital to the communities. The last thing is that to change the mindset from the population from passive to active. So we have three strategies to make it happen. To formulate the health policies, and the second is that to create a healthy environment. I think this is most important because the people spend more time in community, in the company, and also in the campus. So how do we make it to emphasize the health life in the community? And the last thing is to promote healthy behaviors. And there is the three pillars of the vision of Happy Macau: life, work, and learning, as I just mentioned about. So it makes the cornerstone of the health of Macau residents. This is the vision of the Health Macau Blueprint. Let me make hypertension as an example. And we know that the hypertension rate in the population is very quite high, and the control rate to make a good blood pressure is not quite high actually. So we have three levels. From the government level, we make some policy to increase the awareness rate. The second is from the community. I think for the community, also the control rate is from the community. We have to control it well. And the last thing is that the individual. The individual is also quite important because we have to make the people measure their blood pressure regularly. So we have some KPI. We have 20 health goals and also 52 assessment indicators to make it happen. So for the education to the population, the first thing to control blood pressure well is the smoking and the alcohol. And we all know that cigarette and alcohol is not good for the blood pressure. So we have a consultation in the health center for the free smoking cessation. We can we share the QR code to the people. The second thing is the healthy diet, and we have already set some restaurant list to the population as a QR code show. So in the restaurant, we have some quite healthy diet, healthy food for the people. And we also make some videos to the communities, around 20 dishes, and to teach the people how to cook the healthy food. Also, the regular exercise, and many excuses from the people not to do exercise regularly, especially some people working in office. So we make some video to teach them in 5 minutes exercise during work break, also 15 minutes. So let them do exercise regularly. Also, sleeping is also important, and we teach the communities that to not use the mobile phone before sleeping. And mental health is important, but actually it is not very easy to control. And so that for psychiatrists, they contribute much more about this one. And for the disease screening, and in Macau, we are free of charge to the population for the basic disease screening, cancer screening, also blood pressure, glucose, and they are also free of charge. And when, from the screening, when we detect some diseases in the population, they also free of charge to control the basic some disease, hypertension, diabetes, some chronic disease. For the medication, also free of charge. And we also develop apps in mobile phone. People can input their blood pressure, glucose level to the cell phone, and also they can check their consultation medicine from the cell phone by themselves. So make them actively to control their chronic disease. Also vaccination, we also have some free of charge vaccination to the population. So this is my last slide, and I think we can work together for healthy Macau, and Macau government spend a lot to the healthy condition to the population, and needs return to the quite satisfied health condition to the population. Okay, thank you so much.